Thanks for watching. This is YouTube Medical University. Did you know that Mr. Ryu has poor kidney function and high creatinine levels? Have you ever had protein detected in your urine test with a dipstick? This time I will explain from a doctor's perspective the correct way to look at kidney function for people like this. Be cautious of simple advice like do this or eat that to lower your creatinine or improve kidney function. Following such information without proper research may lead to regret. What should you really pay attention to? Rather than just focusing on creatinine, I want you to pay attention to certain other values. There are many foreign patients and Taku-san who are worried because their creatinine levels just won't go down. But this creatinine number is affected by things like age and muscle strength, so it's often highlighted on YouTube and social media, but if you don't really understand it, it can lead to misunderstandings. These days it's said that 1 in 8 Japanese people, or about 13 million people, have chronic kidney disease. To live a healthy and fulfilling life in your later years, it's crucial to maintain healthy kidneys. They remove waste products from the body and also produce blood. They produce hormones, are involved in calcium absorption, and the kidneys truly have essential functions. So when the kidneys become unhealthy, there are multiple causes, and dietary restrictions vary based on the specific cause and kidney condition. It's not as simple as recommending a single diet for all cases. This video will be a bit longer, but by watching it all the way through, you'll learn the correct way to look at kidney function, the symptoms that appear when kidney function worsens, and which foods you should or shouldn't eat depending on the cause. I want to explain all of that, so that's what we'll cover this time. First of all, please forget about cleaning your kidneys with just one thing. So, first I'll explain the correct way to look at kidney function. Then, in the second part, I'll introduce 4 unexpected save our soul signs from the kidneys. Finally, in the third part, I want to talk about something many of you may be wondering. Even if you have kidney disease, is it okay to eat vegetables and fruits? Are there foods you shouldn't eat? I'll explain these points from a doctor's perspective. YouTube Medical University offers information to help improve your health, starting tomorrow. As a doctor, I share this information responsibly. Please subscribe to the channel so you don't miss any new videos. So, you might think that creatinine is the only thing that matters, but please try to forget about creatinine for now. What you should pay more attention to than creatinine, as I'll explain in the conclusion, are the eGFR value and the amount of protein in your urine. Please remember to check these two things. I'll explain the reasons for this. The number called creatinine is actually not that important. What are we really looking at? Well, our bodies have muscles inside. The waste products produced by these muscles are what creatinine measures. Please make sure you understand this clearly, and this waste product that is produced. Creatinine is excreted from the kidneys, so if your kidneys are not working well, this waste product builds up in your body, causing creatinine levels to rise. That's why people with high creatinine levels, it means their kidneys are not functioning well. So as I just mentioned, this value depends greatly on things like muscle mass and age. So if you simply say that a higher number is bad, a man in his 20s with a lot of muscle and a woman in her 80s, if they both had the same creatinine level of 1.0, even with the same 1.0. Actually, the man in his 20s has twice the kidney function of the woman in her 80s. Despite having kidney function that differs by a factor of 2, they both have the same creatinine level of 1.0. It's surprising, isn't it? That's why this man in his 20s, who is very muscular, came to my outpatient clinic with the results of his health checkup because his creatinine level was above the normal range. He was worried because the results were hard to understand, but after doing other tests, I told him not to worry because his kidney function was normal. The crucial aspect is the creatinine value. If you compare someone whose creatinine level goes from 0.4 to 0.6 with someone whose level goes from 3.4 to 3.6, the degree of severity is completely different. For a person whose creatinine goes from 0.4 to 0.6, it actually means that their kidney function has dropped by about 20%, but if someone goes from 3.4 to 3.6, their kidney function has only gotten slightly worse by about 1%. This might sound a bit complicated, but simply put, creatinine is not a straightforward indicator. It's not very reliable, and if you don't understand it correctly, it can be misleading. Since creatinine has been around for a long time, most people are familiar with it. I also sometimes explain things simply using the number called creatinine. But since you're watching this video and are eager to learn, everyone please remember the value called eGFR from today, without worrying about misunderstandings. This eGFR, please think of the number as being out of 100 points. If you drop 40 points from a perfect score of 100 and it becomes 60 points, that's considered chronic kidney disease. Please understand it as meaning that the function of your kidneys is declining. And as this function keeps dropping, when it finally reaches 10% dialysis becomes necessary. That's the kind of value we're talking about. For the number called creatinine, the higher it is, the worse it is. But for something called eGFR, a perfect score of 100 is a good value, so the lower it is, the worse your kidney function is. Please understand it that way. If you have your own health checkup results with you, please take a look at them now. Isn't there a number called eGFR listed there? For those of you who aren't sure, there should be a link for calculation in the summary section. So please enter your creatinine value and check your own eGFR number. This value called eGFR is now considered by the Nephrology Society as the standard value for assessing kidney function. What exactly is this measuring? Previously, creatinine was used to look at muscle metabolism byproducts, but this eGFR is understood as the amount of fluid the kidneys can process in 1 minute. Simply put, the kidneys are like coffee filters. In a coffee filter, picture this. When you pour hot water in, it slowly drips out little by little. The amount of urine produced in 1 minute reflects kidney function. So, if kidney function worsens, less urine comes out, and the filter gets clogged. That's why this eGFR value is the amount of water that can pass through the kidney filter. Please keep this in mind. This eGFR is the amount your kidneys can currently process. You could also call it your current kidney capacity. That's why I said earlier that you should check both your eGFR and your urine protein levels. eGFR shows your current function. If you look at your current ability, then urine protein tells you about your future kidney function. In other words, urine protein is important because it shows whether your kidneys are under stress now or if you need to be careful for the future. So, use eGFR to check your current function in urine protein to predict the future. That's the image I want you to have. There was a patient like this as well. My name is Creatinine. Despite my normal creatinine levels and eGFR, I had to get re-examined during a health checkup. Upon closer inspection, protein was found in my urine. In other words, this patient, even though their kidney function is currently being maintained, the presence of protein in their urine means that their kidneys are under strain. So even if things are okay right now, it's possible to predict that kidney function will decline in the future. This also includes my personal opinion. So for example, even if kidney function seems fine right now, if protein is leaking into the urine, it suggests things might get worse in the future. On the other hand, if kidney function is a little worse and the eGFR has dropped below 60 but there's no protein leaking into the urine at all, then when you compare the risk of future progression, actually, as I mentioned earlier, the risk is higher for those who have protein leaking into their urine. So just looking at eGFR alone isn't enough. I'll talk more about this in the next segment. When it comes to diet, the people who need to be especially careful are those who have protein leaking into their urine. Does that make sense? This protein in the urine is something that's often found during health checkups, but for those who don't have many opportunities to get health checkups, there are test strips you can buy at drugstores to check your urine. Please try buying those. You can even get them on Amazon. It's a simple test where you just collect your own urine and dip the strip in. Please try it at least once, and if you get any abnormal results, go to your regular hospital or clinic. I suggest consulting a nephrology department or similar specialist if possible. That's all for this point. Regarding kidney function, there's a term called creatinine. It's a well-known term, but the way you interpret the value of creatinine depends on your body type. I explained that when the value changes from 0.4 to 0.6 or 3.4 to 3.6, the significance differs greatly. That's why we use eGFR instead. I also talked about checking a value called urine protein. This eGFR is a value that shows how much blood can be filtered by the kidneys in 1 minute. It's an estimate of the water amount. 100% is considered the best condition. If it falls below 60, it's considered chronic kidney disease. It means kidney function is declining, and the eGFR shows the current kidney condition. Furthermore, consider not only your kidney's current state, but also if they feel overworked or strained at the moment. I mentioned urine protein is important for predicting kidney health. It may have been hard to understand, so please ask as many times as needed, and I'll gladly explain again. As a reference, if you're new to this and found it useful, please like or engage with this video to help it reach a wider audience. Now I will introduce 4 Save Our Souls signs from the kidneys that are surprisingly not well known. In fact, the kidneys are called silent organs, and even when kidney function is gradually declining, there are rarely any clear Save Our Souls signs in the early stages. So, to give you the conclusion first, there are almost no early symptoms from the kidneys in most cases. There may be cases where a stone gets stuck in the urinary tract and causes pain, but it's very rare for your physical condition to worsen just because your kidney function has slightly declined, so please be careful about that. This is because, at first, the kidney function is still almost perfect. Even if your kidney function drops from a perfect score of 100 to 90, 80, or even 70, the remaining 70% of your kidney function will work hard to compensate, so you won't really feel any different and can go about your daily life as usual. The kidneys are really hard workers. Kidney transplant. Even after a partial kidney transplant, there are people who can live with their remaining kidney function, so I think you can understand that when any symptoms of kidney problems do appear, it may already be progressing at that point, but you shouldn't worry and stop eating because of it. Furthermore, if it keeps progressing, there's a possibility that you'll eventually need dialysis. Peritoneal dialysis differs from hemodialysis, where you're connected about thrice weekly for around 4 hours each session. With peritoneal dialysis, you exchange waste by infusing dialysis fluid into your abdomen, letting it absorb waste, then draining it out and replacing it with fresh fluid. Peritoneal dialysis is another option. It allows people to do dialysis while sleeping at night, even if they are working, which is an advantage. It's gradually becoming more common as it gets more attention. That's true, but I don't think it's something you should be overly optimistic about, so it's important to notice symptoms early and take action as soon as possible. I'll introduce some unexpected Save Our Souls signs from the kidneys. Here are 4 Save Our Souls signs from the kidneys. The first sign is frequent urination at night. Nocturia means having to urinate more often during the night. You might think that when your kidneys get worse, you produce less urine. So why does it lead to more frequent urination? Let me explain the reason so you don't forget. Even if your kidney function drops from 100% to 60%, your kidneys can't remove waste from your body as efficiently as before. Normally, when we're sleeping, our bodies control urine production so we don't have to get up to use the toilet. But when kidney function declines, even at night, your body can't properly manage waste. So you end up producing more urine and have to get up to use the bathroom. So it's not that the total amount of urine increases, but rather that the frequency of urination increases, especially at night. And this is an early symptom of declining kidney function. Producing more urine at night is not uncommon and could be a sign from your kidneys. Another unexpected kidney Save Our Souls sign is swelling in your lower legs. There are other reasons for increased nighttime urination, which will be explained as the second symptom. It's swelling in your feet. When your kidney function declines, there are 2 main reasons why swelling in the feet can occur. The first reason, as I mentioned earlier, is that when your kidneys drop from 100% function to a lower level, your body can't get rid of waste products and excess water as efficiently. When that happens, fluid starts to build up in our bodies. Because of gravity, it's hardest for blood and fluid to move from the lowest part of the body, your feet, back up. So swelling tends to show up in your feet first. Of course, swelling can also occur in other places, like your chest if fluid builds up there, or even in your hands and face. So there are other reasons why swelling can appear as well. When your kidney function declines, the kidneys gradually become damaged and a protein called albumin starts to leak into your urine. As this happens, the amount of protein in your blood decreases. Protein, especially albumin, has the role of drawing water into the blood vessels, so when you lose this protein, the blood vessels can't hold on to water as well, so fluid starts to leak out into the spaces between tissues like under the skin of your hands and other areas. Because of gravity, this often leads to swelling in your feet. So swelling can happen either because your body can't get rid of excess fluid, or because you've lost too much albumin and your blood vessels can't keep the fluid inside. There are 2 reasons for this, but in the second case, where albumin keeps leaking out, you can have significant symptoms even if your blood test eGFR value is still preserved. In other words, these symptoms can appear early on. In such cases, albumin is found in the urine and outside the body. since proteins like albumin and other substances are leaking out. If you test the urine for protein, you might find it. So even if your blood test results like creatinine are normal, it doesn't necessarily mean your kidneys are healthy in the long run. That's why it's important to check for protein in the urine as well. Here are 4 unexpected save our soul signs from the kidneys. The third one is this: unexplained fatigue and decreased concentration. When we talk about fatigue and decreased concentration, people often think of mental causes. However, this may not always be true for those more knowledgeable about medicine. Some people might think it's a mental issue, or for those with more medical knowledge, they might suspect the thyroid, which is an organ that produces hormones that regulate the body's metabolism. When the thyroid's function is low, it can also cause fatigue and sluggishness. But it's not just that. The kidneys, when their function declines, can also cause similar symptoms. One of the main reasons for fatigue and decreased concentration is that the kidneys are responsible for removing waste products from the body. If these waste products aren't properly eliminated, toxins build up in the body. This is called uremia, and as a result, the body becomes more acidic, leading to symptoms like fatigue and decreased concentration. But that's not all. The kidneys also produce a hormone that signals the body to make blood. This hormone is called erythropoietin. The name might not be familiar, but the kidneys actually send instructions to make blood. When the kidneys are weak, this hormone isn't produced, so blood isn't made properly, leading to anemia. When you're anemic, even a little movement can make you tired, and your body can't transport enough oxygen, which also lowers your concentration. I'm a man in my 30s. As a foreigner, I've recently been struggling with concentration and fatigue. With a family history of cancer, I was concerned I might have it too, so I went to the hospital for a checkup. That's where I'm at. In the end, no cancer was found. His kidney function had significantly declined. In fact, he also had high blood pressure and diabetes. Despite past warnings, he couldn't find time for hospital checkups due to his busy work schedule. As a result, his kidney function declined and he started feeling tired, which is why he was admitted to the hospital. There are many potential causes of fatigue besides kidney issues. Get ample rest and maintain a balanced diet to improve your condition. If there is no improvement, consult a specialist promptly, as unexpected kidney issues may arise. Here are the 4 save our soul signs, and this is the 4th one. Trace amounts of albumin in the urine. When we talk about save our soul signs, the idea of trace albumin might not sound very alarming, but I want to emphasize that in many cases, there are no symptoms at all. That's why I'd like to talk about this item, trace albumin in the urine. To catch early signs of declining kidney function, it's important to check your urine for protein. However, sometimes regular urine tests can't detect trace amounts of albumin, so looking for trace albumin in the urine is another important method. This test detects trace amounts of albumin in urine proteins. I frequently use it in my practice to assess kidney function in diabetic patients visiting the clinic. However, for patients without diabetes, this test may not be covered by insurance, so urinary protein tests are not routinely done for everyone. In the early stages of proteinuria, albumin is typically the first protein to leak into the urine. That's why, to really detect urinary protein at the earliest stage, it makes sense to look for this microalbumin. So, if you're concerned about your kidney function or want to see if your kidneys are under any burden, even just a little, you might want to check for microalbumin in your urine. As for the test items, I think it's a good idea to consult with your primary care doctor or nearby nephrologist. Microalbumin in urine. If even a small amount of albumin is found in your urine at this stage, it can be detected early and you can start paying attention to your diet and exercise habits. Reviewing your current medications may help you live your daily life without straining your kidneys. There's a good chance you can maintain your kidney function. Please consider this. This is a review up to this point. 4 unexpected save our soul signs from the kidneys. First, nighttime frequent urination. I introduced the symptom where you urinate more at night than during the day. Second, swelling in the lower legs. When your body can't get rid of excess fluid, it tends to accumulate. On the other hand, when protein leaks into the urine, water also leaks out from the blood vessels, causing swelling. I explained the reasons for the second symptom. Next, the third sign is dullness in the body and decreased concentration. This happens when toxins build up in the body, a condition called uremia, or when the body becomes acidic. It can also occur when the hormone erythropoietin, which is responsible for making blood, is no longer produced properly, leading to anemia. Lastly, it's crucial to note that kidney failure often lacks early symptoms. Therefore, detecting decreased kidney function early is vital, which can be done by checking for trace amounts of albumin in the urine. I introduced the test items. This might have been difficult to understand. If there's anything you don't understand, please feel free to ask questions in the comments section. Also, if any of you have experienced symptoms in the past, please share them in the comments as well. I think it will be helpful for others too. If you haven't subscribed yet, please do so to not miss any videos. It would make me happy. So finally, if your stomach isn't feeling well after the third period, is it better not to eat vegetables and fruits? I'll introduce 4 foods that people with sensitive stomachs should be careful with. First, let me start with the conclusion. For those whose stomachs aren't feeling well, it's not true that you shouldn't eat vegetables and fruits. In most cases, fruits and vegetables actually have a positive effect on the kidneys. However, for some people, specifically those with high potassium levels, it's important to be careful. Please keep this in mind. If you're wondering whether the answer is good or bad, or if you're not sure what to think, let me clarify. It's not that simple. It really depends on the specific situation and the details of your kidney condition. That's why it's important to pay attention to more detailed information. Whether something is good or bad for your kidneys depends on the cause and the severity of your kidney issues. Your body's mineral balance can also change depending on your condition. That's why we, as medical professionals, are here. So in the next part, I'll explain whether it's better for you to eat vegetables and fruits, or if you should avoid them. In general, when it comes to foods that put a burden on the kidneys, it can be a bit complicated. But if you understand this, you won't regret relying on simple information. So please listen carefully. For those who eat a lot of vegetables and fruits, it's actually very good for conditions like high blood pressure and diabetes. There is solid evidence to support this. For most people who develop kidney problems, the main causes are high blood pressure and diabetes. Of course, there are other causes as well, such as autoimmune diseases and various other factors. But for the majority, high blood pressure and diabetes are involved. In that sense, when it comes to chronic kidney disease, eating vegetables and fruits generally has a positive effect in preventing kidney problems. And among these, minerals like potassium have the effect of lowering blood pressure. Potassium itself is not harmful to the kidneys. However, when kidney function is impaired, because people say potassium is bad, some of you might think potassium is harmful to the kidneys, right? There are also many healthcare professionals who misunderstand this. To be clear, when we talk about potassium, it's not that it's bad for the kidneys, but rather, when potassium levels get too high, it's actually bad for the heart. It's not the kidneys, it's the heart. When potassium levels get too high, it causes arrhythmia, which is not good. It's not that potassium is bad for the kidneys, but rather people with kidney problems have trouble removing potassium from their bodies, and because of their diet or medications, potassium tends to build up. Eating potassium-rich foods with kidney problems can cause arrhythmia and be dangerous, which is why it's not recommended. Misunderstanding this may lead to wrongly believing that potassium is bad for the kidneys, or that eating it will worsen kidney function. Potassium is beneficial for the kidneys, so don't worry. Are you following me so far? Based on the 2014 chronic kidney disease guidelines, individuals with an eGFR of 45 or higher out of 100 are considered alright. For those with a score between 45 and 60, it is written that there is no need to restrict vegetables or fruits. For most people with chronic kidney disease or poor kidney function, there is no need to overly restrict vegetables or fruits. For patients with chronic kidney disease, your eGFR falls within the 45 to 60 category, so please rest assured. Isn't that a bit unexpected, even for patients with chronic nephritis at this stage? As long as your doctor regularly checks your potassium levels and your potassium remains stable between 3.5 and 5, there is no need to worry. There is absolutely no need to drastically reduce the amount of potassium you are currently consuming. If you boil vegetables too much, the amount of carbohydrates and fats will increase, and that can be a problem. In fact, worsening high blood pressure or diabetes is actually worse for your kidneys. These foods themselves help regulate your body's internal environment and can also help relieve constipation. It's also said that dietary fiber can lower the risk of certain cancers, such as colon and stomach cancer, so it's an important nutrient. The people who need to be careful with vegetables and fruits are those whose eGFR has dropped below 45, or those whose potassium levels are high. In other words, people with especially high potassium levels, or those in these situations. Since individual differences matter greatly, please consult your doctor before making decisions. Sometimes you don't need to worry about potassium at all. Many people think they need to avoid vegetables and fruits completely. So, from here I'll specifically explain which foods you should be a little careful with and which foods you shouldn't avoid too much. I'll introduce 4 points like this. 4 carefully selected dietary tips that are good for your kidneys. Here's the first one. Try to choose solid foods over liquids. In fact, there are studies showing that people who mainly consume vegetable or fruit juices, as well as those who eat real foods like vegetables and fruits, have different health outcomes. Those who rely too much on juices tend to have worse health, while those who eat real foods like vegetables and fruits tend to be healthier. Obesity itself is a cause of arteriosclerosis and one of the factors that can worsen kidney function. From this perspective, liquids and juices often contain added sugars, and it's easy to consume too many calories, which can lead to weight gain. Also, nutrients like potassium dissolve easily in water, so even if you drink juice, you may not get the full nutritional value of potassium. And in the process of making juice, important nutrients like vitamins and dietary fiber are often lost. For these reasons, it's better to avoid taking in unnecessary calories from liquids. I think it's better to keep in mind that you should get your nutrition from solid foods. For example, when you eat 1 orange versus when you drink a glass of orange juice, in order to make 1 glass of orange juice, 2 or 3 oranges are often used. Depending on the situation, even if it says 100% orange juice, sometimes sugar is added, and the amount of calories can also increase. So, rather than drinking a glass of orange juice, it's actually better to eat 1 whole orange. From the perspective of food fiber, and also from the perspective of feeling full, it's better, so please try to buy real fruits. I think that just by adding half a lemon or 1 banana to your regular meals, it can make a difference, so please give it a try. 4 dietary habits that are good for your liver. The second one is this. For those who need to limit potassium intake, choose low potassium vegetables. While potassium is generally good for the liver, people with high potassium levels should be careful not to eat all vegetables indiscriminately. Vegetables are nutritious and their fiber is beneficial for high blood pressure and diabetes. Instead of avoiding vegetables to reduce potassium, choose low potassium options. Here are some vegetables relatively low in potassium. Curry, cucumber, ritasu, lettuce, kiabetsu, cabbage, tamanegi, onion, and nasubi, eggplant, are low in potassium. In contrast, banana, haurenso, spinach, avocado, jagaimo, potato, and tomato are relatively high in potassium. Keep this in mind when planning your regular meals. Reduce 1 serving of high potassium vegetables and add 1 serving of lower potassium vegetables instead. This adjustment can help manage potassium intake. Please consult with your primary doctor and check your blood test results to make adjustments. Also, as is well known, when you boil vegetables, potassium dissolves into the water, so the amount contained decreases. For example, if you boil spinach in plenty of water, the potassium it contains will actually, even if there were 690 milligrams, it will be reduced to 240 milligrams, so you can remove nearly 70% of the potassium. For people with kidney problems, this is good, but if you have too much potassium, it's not good for your heart. So, if you are concerned about potassium, boiling vegetables is one way to reduce it. Here is the third point about a diet that's good for your kidneys. It's about taking the right amount of protein. There are many misunderstandings about this, but some people think that protein puts a burden on the kidneys, so if you have kidney problems, you shouldn't eat protein. This is not correct. Eating too much protein is not good, but not eating any protein at all is also not good. Please remember to take the appropriate amount. Please recall your eGFR value. If your eGFR is above 60 out of 100, you do not have chronic kidney disease, so you don't need to worry too much. If your weight is 132 pounds, the recommended daily protein intake is 2.1 ounces. Try to use this as a guideline. For those who exercise or do muscle training, it's said that you should take a little more. Next, for those whose eGFR is between 45 and 60, you don't need to be overly concerned about protein. If your weight is 132 pounds up to 2.1 ounces is fine, even if you eat a little less. 0.028 ounces per kilogram is enough. If you weigh 132 pounds, you can take up to 1.69 ounces of protein per day. Some people think that because their kidney function is a little bad, they shouldn't eat too much protein, or that eating too much protein will make their kidneys worse. If you misunderstand and think you shouldn't eat protein, you might end up with sarcopenia, which is when you don't get enough protein and your leg muscles become weak. This increases your risk of falling, and even if your kidney function gets a little better in the future, your legs might still be weak. Consequently, the risk of illness and reduced quality of life increases. Please remember that taking too much protein is also a risk. For people whose kidney function is between about 15 and 45, you do need to be a little careful with protein intake, and it's necessary to get about 0.6 to 0.028 ounces of protein per kilogram of body weight. If you weigh about 132 pounds, you should aim for about 36 to 1.69 ounces of protein per day. Maintain your intake within the recommended range while ensuring a minimum of 1.27 ounces of protein daily. Even if you eat one serving of protein, for example, chicken breast, it only contains about 10 to 0.7 ounces of protein. So if you're not careful, you might not be getting the recommended 1.27 ounces per day. Please make sure to check how much protein you're actually consuming each day. Here are 4 recommended eating habits for your waistline. The last one is linseed, a mineral. Actually, when kidney function declines, phosphorus, which is a mineral, tends to build up in the body. If phosphorus accumulates too much, it can eventually lead to hardening of the arteries and blood vessels, increasing the risk of serious health problems, and in some cases, it can even be life-threatening. That's why it's important to be mindful of your phosphorus intake, but please consult your primary care doctor about this. There are actually 2 types of phosphorus: plant-based phosphorus and the phosphorus found in processed foods and animal products. The phosphorus in processed foods and meats is more easily absorbed by the body, so it's a good idea to limit your intake of processed foods. And also be aware that foods like retort curry can contain a lot of phosphorus. Choosing foods with less phosphorus is a wise option. The plant-based phosphorus found in foods like soybeans is not absorbed very efficiently by the body, so you don't need to worry about it as much. If there's one thing to keep in mind about vegetables and soy products, it's that I often advise patients to try to avoid processed foods as much as possible. Processed meats, in particular, are considered a major risk factor for kidney disease. Processed meats often contain many additives, so it's important to be careful about consuming them to reduce the risk of various diseases. This is a review of the 3 restrictions. It was once said that vegetables and potassium aren't good for the kidneys, but that's actually not true. They actually have a positive effect on the kidneys. However, for people whose kidneys are in bad condition, potassium can build up easily, so high potassium levels can harm the heart and cause arrhythmia. People with poor kidney function should be cautious about potassium intake. For those who don't need to worry, please feel free to consume it without concern. That's what I wanted to explain. That's why I suggested picking low potassium veggies, boiling them, and opting for whole fruits and vegetables over juice. Therefore, since too much protein can put a burden on the kidneys, please be careful not to overdo it. Also, restricting protein too much can increase the risk of muscle weakness and falls, so please be cautious about that as well. Surprisingly, most people are not consuming too much protein, so rather than restricting it, first, please make sure to check whether you are actually getting enough protein yourself. If you want to know more details about protein, I have posted a video about it in the past, so if you like, please take a look at the summary section. And finally, about phosphorus as well. People with poor kidney function should be cautious about phosphorus, commonly found in processed and deli meats, due to its high absorption rate. Maintaining healthy kidneys requires a well-balanced diet, not just focusing on individual nutrients. Please be careful about information that sounds too convenient or too good to be true. In conclusion, why is it bad for your kidneys? The severity depends on your kidney condition, but the things you need to be careful about will change depending on your condition, and there really aren't any foods that will absolutely make your kidneys better just by eating them. Even if there are some effects, they're only minor. In conclusion, when it comes to the main causes of kidney problems like high blood pressure and diabetes, the most effective way is to properly manage things like high blood pressure and diabetes. So if you have high blood pressure or diabetes, please check out the videos I've posted in the past. You can also watch the summary version here. Thank you very much for watching until the end. I really appreciate it. The video was challenging, but if you watched it fully eager to learn, you likely understood it. If this was helpful, feel free to listen to it multiple times, leave comments, and share your learning as a reference for others. If you enjoyed the video, please like and subscribe for encouragement. See you next time. This has been Dr. Sugo from the Department of Integrated Medicine, sharing lessons from patients on living a healthy life from your 70s onward. I became the #1 best-selling gift ranking in all 4 Amazon departments. While working as a regular doctor, I learned important ways of living from my patients, and I summarized those lessons and health methods into one book. It's a book for people like me who want to live a healthy life in their own way. It's on sale with great reviews, so please check it out.